evening, then.
Welcome to the Community Cafe. So today we have Mary Mueller, the director of the library, Clinton Bigelow's library, and then we have Gina Grabowski, project coordinator from Central Mass Tobacco. So today they're here to talk to you guys about Breathe Strong seminar, and basically they're going to be giving you some tools for quitting smoking. Some of the things that they're going to talk about include reasons to quit, making a quit plan, getting support, resources to help you quit, and dollar and cents. So they got some good information to give you guys this evening for the next few minutes. So again, welcome, and here we are.
I just want to say that this program, and we have a lot of health literacy programs with the library this year, so I handed a flyer out, and you're welcome to take the pen and pad. And the pre-survey, just how much do you know about quitting smoking and the dangers of smoking beforehand, and then there'll be a post-survey, but Tina is going to do the presentation on that.
Great. Well, thank you, Marie. Again, my name is Tina Grasowski. I'm the project coordinator for the Central Mass Tobacco-Free Community Partnership. It's a grant-funded program through the UMass Medical School from the State Department of Public Health. We work to reduce smoking and secondhand smoke in all of central Massachusetts. So that's all the 63 towns they're in Massachusetts. So I spend my time working to prevent young people from starting to smoke, and then I help provide resources to help people quit smoking who have been smoking. And that's what I'm going to talk about today. I want to thank Marie for having me here. The main components of thinking about quitting smoking is that, number one, it's still the number one preventable cause of disease in the United States. And what we would like to do is help provide resources for you to understand that we know that quitting smoking is really difficult. Nicotine is the hardest drug to quit that there is. And we know that it can take many, many times to quit smoking. So our latest flyers and information that I have right here, and I'll give you the information that Marie has on her website. There's a new website called Keep Trying MA. So if you use a computer or you have a smartphone, you can go on the internet and go to Keep Trying MA.
And if you don't, and you want to check it out, you can come to the library because we have free computers.
There you go. You can use the computers at the library. Keep Trying MA is a link to the Mass Smokers Helpline, which is the telephone counseling that we provide for free, 24 hours a day, to help people think about making a quit plan to quit smoking and then getting the counseling and support to help them. We know that quitting smoking is really difficult, so if you can get support from counseling and use the medications, which I'll talk a little bit about, which is the nicotine replacement therapy, which I'll talk about in detail, you have 3 times as more likely to have a successful quit attempt if you use both those together. Now, it doesn't mean it's easy, okay? Quitting smoking is very difficult, but we do have ways to make it easier, and that's what I'm going to talk about today. Welcome. Have a seat if you'd like. Are you a smoker? So the main components of thinking about quitting is making a plan to quit, putting your resources together to help you quit, getting some information about medications, and how you're going to support yourself through the rough times, which is the cravings and the withdrawals that you all know about, okay? Making a quit plan is about picking a day that you're going to quit smoking completely. We usually recommend, and if you've tried to quit before, we recommend either a date at least 2 weeks away or a month away, because you're going to have to line up your support and get your ducks in a row, so to speak, before you can make the plan. What we don't recommend is deciding, well, today I'm going to quit smoking. You have to make a plan and set up the plan and get support so you can be successful, okay? What do you want to think about is why you want to quit smoking. What are your reasons to quit? Most people need to think about their health, which you just shared about before. Your health is the number one reason. If you go to the doctor is going to tell you it's the number one reason to quit smoking. The next reason is for your family or your friends. If you have grandchildren, nieces or nephews, if you have adult children, all of them are going to want you to quit smoking because you'll be healthier, you'll have more energy, and financial incentive is a big reason to quit smoking. So today in Massachusetts, regular combustible cigarettes, brand name cigarettes, can cost anywhere $8, $9, $10 because of the tax on cigarettes. And even roll your own cigarettes. Even roll your own cigarettes it costs money. So if you spend $10 to $12 and you spend a pack of cigarettes a day, that adds up almost $4,000 a year that you're spending on nicotine, which is really what we're talking about, nicotine, that you could be spending on food, you could be spending on rent, you could be spending on clothing, you could be spending on a car, you could be spending on your phone plan, all the things, and never mind just doing something for your own fun, like going to the movies or going out for dinner or taking a vacation. So your health is a really important reason, the number one reason. Your family and friends are a really important reason. And financial incentive is a really important reason to quit smoking. So once you've looked at yourself and made those reasons, you want to keep holding on to those, because when it's hard to quit and you're going through the cravings and the withdrawals, you want to have those reasons close to you to keep yourself motivated to quit. So the next thing you want to do is think about looking at getting support. So in Massachusetts, we have the Massachusetts Smokers Helpline. We wish that we had more people that you could go to in person, face-to-face. But we don't have that support that we used to have when there was a lot more resources from the state, and those don't exist. What you want to do first is go to your doctor, your primary care provider, and if you have Mass Health insurance, Mass Health is the best coverage for smoking cessation products, like the nicotine replacement. So you want to go to your doctor. You want to talk to your doctor about what's the best method to quit smoking for you, because your doctor is the only person who knows if you're on other medications and what other health risks you have. So you want to check with your doctor and your providers. Now, when you quit using nicotine and you start using nicotine replacement, that's when you're going to have the most withdrawals from the nicotine. Withdrawals from nicotine, normal withdrawal from nicotine causes headaches. It causes people to feel extreme fatigue. It causes people to be having a hard time sleeping, and it causes people sometimes to have indigestion because you're starting to withdraw from the nicotine. Okay? These are normal symptoms from nicotine withdrawal. If you quit smoking to get your nicotine and start using a patch or the gum or the lozenges, or they make a nasal spray, they also make an inhaler now, looks like an inhaler. We'll talk about the vape in a few minutes because that's really important. All of those are going to supplement the nicotine in your body because you're going to stop smoking to get the nicotine. So when you stop getting the nicotine from smoking, you're going to start having withdrawals. What you want to look at is what your triggers are for using nicotine. So a lot of people, first thing in the morning before they even get out of bed, they have a cigarette. A lot of people get up out of bed, have a cup of coffee, they have a cigarette. A lot of people get in the car to start driving, and they have a cigarette. Alcohol can be a trigger for smoking. Talking on the phone can be a trigger for smoking. So it's really important that you look at your own patterns of behavior, what are your triggers for smoking, and then looking at how you can make substitutes for those behaviors. I'm just going to give an example. If you wake up in the morning and before you even get out of bed, if you have a cigarette, before you even think about quitting, you want to change your behavior and change your brain. You want to get up, maybe take a shower, have some breakfast, have a cup of tea, then have a cigarette. Go outside and have a cigarette. So you're changing about 4 behaviors or 5 behaviors before you even quit smoking. The biggest challenge for quitting smoking is the nicotine and changing your behavior. It's very hard to change behavior. We all know it's really hard. It's hard to change behavior to lose weight. It's hard to change behavior to get more exercise. It's hard to change behavior to quit smoking. So the main important thing then is about looking at the triggers and then making your behavior changes with that. Then you want to look at nicotine replacement. I talked about if you can go on the patch. The main thing about nicotine replacement is you have to replace the same amount of nicotine that you got into your body while you were smoking with the other products. If you're a pack-a-day smoker, each cigarette has between 1 milligram and 2 milligrams of nicotine. There's 20 cigarettes in a pack. That's between 30 and 40 milligrams of nicotine if you're a pack-a-day smoker. That means you have to at least get a patch or an inhaler that has at least 24, the highest, which is 24 milligrams. Because if you only get a 14 milligram patch or a 7 milligram patch, you're going to start having withdrawal and craving because you don't have enough nicotine in your system replacing what you were getting while you were smoking. So that's why it's so important to talk to your doctor about how much you smoked, how much nicotine your body is used to getting, and then how you're going to replace that nicotine with the other products. Okay? Does that make sense? Okay, that's the science of it, and that's really important. If you don't get the right amount, then you're not going to have a successful attempt, and you're going to get frustrated, you're going to get angry, you're going to want to smoke, and you're going to go back to using nicotine again because you just don't have any nicotine replacement enough in your body. That's the science of it. Then you have to get some counseling because you are going to have cravings and withdrawals. So at 10 o'clock at night or 4 o'clock in the afternoon, what are you going to do? You need someone to talk to about how you're going to deal with the craving, how you're going to get through the craving, and how you're going to use the nicotine replacement. The craving is time limited. You start having the craving for the nicotine, it increases, reaches a peak, and then it starts dropping back down again. It does go away. But you have to learn how to understand that it will go away and that you have to be able to tolerate it enough to understand the craving is going to get intense and then it's going to drop back away. You can use some deep breathing, some distraction, drinking some water, and getting the counseling and the nicotine replacement. Okay? If you get really frustrated and don't have enough nicotine and give in to the cravings, that's where it's so difficult. Does that make sense? Okay. Any questions about that?
Not a question, just a comment. My mind is going everywhere.
Are you a smoker?
Oh,
Okay.
and I quit successfully one time.
Good for you.
And I just quit one night. My husband quit at the same time. We both, I was off for 3 years. But that's all right. What I was thinking as you were saying that the craving goes like this, to me, that sounds like labor pains.
Uh-huh.
That sounds like having my kids.
Right.
And we did do breathing.
Right.
We did. It was all that little
Yep.
kind of stuff.
Yep.
But you did breathe through it.
Right. So
You know,
this is,
there's something about
that's
the
right.
oxygen or
That's
whatever.
right. That's right. So this is a little bit about taking deep breaths, like 4 or 5 deep breaths and breathing out. Sort of a more kind of a mindfulness meditation kind of way of approaching it.
The other
But it's the
thing is,
same.
Have you ever heard, because I had 2 good friends, that a husband and wife, and they quit. Have you ever heard that sometimes it's your clothes, sometimes it's the furniture in your
Yes.
house, if you smoke indoors.
That's right.
And those triggers, because the smells are all around you.
That's right.
So like spring cleaning time.
That's
you can
right.
Strip the windows.
That's right.
And wash the curtains.
That's-
That's the week to do it.
Absolutely.
You know? And the other thing is that this couple very successfully, because it exudes through your skin, right? They would shower
Yep.
3 times a day, no problem.
Yep.
Just go and shower and just truly wash away
The toxins.
the toxins as they leave you.
That's right.
You know?
That's right. So it takes about 3 months. To get all the nicotine out of your system. The hardest time is going to be the first month because that's when the cravings and the withdrawals are the most intense. If you can get through the first month, That's going to be the hardest part. But what you have to know is it's going to get better and it's going to get easier. And having the counseling and support is really important. Often when people start smoking again is when they have some kind of stress in their life.
Yeah, wallpaper in my bathroom. That did it. That brought me right back to ground zero. I had it. It was a foil paper, and my friend was with me, and we looked at each other and just shook our heads. It was awful. It was awful.
So the fact that you did quit before, you know what it's like to quit, can be a resource. So when you decide to quit, or if you decide to quit again, thinking about what worked before and talking to a counselor about that will really be helpful, because you want to use what worked before. That's right.
Slip and you have a cigarette.
That's right.
You can't just knock yourself down.
That's right. What you want to do if you slip is you want to go back to your quit plan and start all over again. That's right. Not engage in negative thinking.
I'll tell you one thing I did. I decided the money I wasn't spending on cigarettes, I would spend on me. So at the grocery store on Friday, I'd buy myself a bouquet of flowers. If I went all week
That's great.
without a cigarette, I had a pretty bouquet on my kitchen table.
That's lovely.
You know, I loved it.
That's lovely. That's great. So that's another incentive. I work with a lot of people who have been smokers and then they quit, and we talk to them about what helped them to quit. One woman had quit smoking for 7 years, and every week she took the money that she would have spent on cigarettes and put it into a big water bottle jar and saved up for 7 years, and she went on a cruise, spent $10,000 and went on a cruise. So in the short term, that sounds like a wonderful thing to save your money and buy yourself a bouquet of flowers. That's awesome. So, so I'm just going to finish a little bit by talking about the vaping pens and the vape pens and the hookah pens, because that's really what's popular right now. What you need to understand about the vape is that they all have nicotine in them. Even if they say they have 0 nicotine, they're going to have nicotine in them, because they're all made by the tobacco industry, and the #1 job of the tobacco industry is to get people hooked on nicotine, because they want to keep you on their products. Let me just finish. So nicotine is a drug that elevates your blood pressure and increases your heart rate. That's what nicotine does. So even if you get rid of the combustible cigarettes, the regular cigarettes, and use the vape pen that has the nicotine in it, nicotine is a drug that's not good for your body because it increases your blood pressure. It's called a vasoconstrictor, so it squeezes down your veins and arteries and makes your heart work really hard. It's not good for your body. It's not good for young brains either, because your brains are still developing. So nicotine is a drug that is very addictive, and it's not good for your body. So we don't recommend using the vape pens to quit smoking. If you have used them to quit smoking and you've already stopped using regular cigarettes, that's a good thing. But now you have to get off the vape because it's still being addicted to the nicotine. Well, that's reinforcing the behavior. That's just reinforcing the behavior. So that's why you want to think about trying to use an inhaler to get the nicotine, a patch, the gum, or the lozenges. So you have to need to talk to your doctor. You want to talk to your doctor. They sell lozenges over the counter, yes.
Does that have nicotine in it also?
Yes, it has nicotine in it. And again, you can use the nicotine lozenges and use the patch and the inhaler. So if you're having sort of breakthrough cravings, 5 o'clock in the afternoon or 1 o'clock, yeah, have a seat. We're almost finished though, but you can still sit down.
Yeah, I called a couple of places, I'm not getting much information.
Okay, I can talk to you about that. Let me just finish my little talk here. We're just finishing up. So that's why you can use the lozenges or the gum for the breakthrough cravings, even if you're on the patch or even if you're taking medication. The medication, it would be like Chantix, Wellbutrin. Those are medications that you get a prescription from the doctor, and it's not nicotine replacement, but it works on your brain like nicotine replacement. But you have to go to your doctor and you have to get a prescription to use those. Any other questions?
Are there any really side effects from the patch or anything?
It depends. Everybody's different. You should talk to your doctor about the side effects of the patch. Some people get rashes on their skin. Some people are allergic to them. So have you ever tried one before yourself?
No, but I've seen the advertisement for Chantix and stuff. Looking at the downfalls of them, I don't even want to try that.
Right.
I just seen the downfalls. Some people, yeah, but
That's right.
that's
Some,
my luck. It won't happen to me.
that's right. Some people don't, it doesn't work. So the Chantix doesn't work, so they'll try Wellbutrin. If those don't work, you can try the patch. Or you can try the patch first.
That's what I.
Yeah. And Mass Health will pay for the patch if your insurance covers it. If you call the 800 quit line or the keeptryingma.org, they will send you a couple weeks of free patches if you have Mass Health. So if you call the number and talk to the counselor, they'll mail you free patches to get you started.
I went through them. I had a hell of a time, and I got nowhere with trying the Mass Health quit thing on the internet.
Yeah. Mass Health are you talking about, or are you talking about the counseling?
Oh, I'm talking about UMass.
UMass Memorial Medical Center? Yeah, well, right now there is nobody there to do counseling anymore.
Oh,
The two people who used to be at Mass Medical,
yeah.
they fired them. They got rid of them.
Did.
There used to be a man named Greg Seward and a woman named Nicole Day.
Because I had my liver done, and I can hardly breathe now. I don't know I have a hard time. I just started getting out the past couple of days.
Good.
I had bronchitis for 3 months. I've had 3 long X-rays and strips up the ass.
So it sounds like you need to get some counseling. Hold on 1 second. So I'm just going to say thank you. I'm going to finish up here, and then I can answer individual questions. But I'm going to say thank you for coming to the presentation. And I want to thank Marie again. Thank you, Marie.
Thank you for coming, and seriously, if you know, in the smoking realm, Tina is definitely the person to call, and I think she gave you stuff if you need it. But the library also has, if you have other health questions, we have some great resources to help you
You
out.
have somebody up there for Mass Health?
We don't.
I
I've been
think
trying.
There's
Jody
somebody
here.
Yeah, but
Yes.
she's gonna, everything's going on at the same time.
Yeah, but you need to. Yeah, you should talk to Jody
Well,
or
I'm
the young
gonna
woman there
talk to somebody soon anyway.
to
but,
get. Are you on Mass Health? Because you had
yeah, I've been
surgery,
on Mass
so
Health
yeah.
For years, yeah.
If you're on Mass Health, that will pay for your patch.
Yeah.
It will cover the medication if you decide to go on medication. But you'd have to talk to your doctor first.
Well, I'll see here the 29th, so, but I want to talk to you first. I gotta get a packet of all the information.
Yes. Yeah.
Because I gotta get, I'm getting to the
1
point
second.
scared.
We have someone that would hypnotize successfully against smoking.
I do not. I don't recommend hypnosis.
Okay, because I actually, many years ago, I was very successful in losing weight through hypnosis.
That's great.
Why wouldn't you recommend it? My daughter.
We don't have the. We just don't have the research. We only recommend science-based information, and we don't have any research to show that proves that hypnosis works with quitting smoking.
So this
If,
gives me people to get a hold of her.
And they've never gone back.
well,
And they tried the Chantix, they tried a lot of things.
well, there's nobody that says you can't try it. We just don't recommend it.
The science of acupuncture, do you believe in that?
Acupuncture is a good relief for pain management, and it's a good relief for stress management. But it's not a method to quit smoking. It's like an adjunctive therapy.
The only reason I'm asking that is because I was talking to somebody about that the other day, quit smoking. Their father smoked for 40 years, he went to acupuncture, and never had a cigarette after.
So it's worth trying. Mass Health doesn't cover
No,
acupuncture.
I was just wondering, do you personally believe it?
I personally use it myself.
Did it work?
I didn't use it to quit smoking. I use it for my own just general health and well-being. And it's a wonderful tool. It's great.
Because I don't know how they do that, but
Well, it works on the meridians in your body that help your blood flow. So anything that helps keep your blood moving around your body is going to help your health. So there's, it's just not a method to quit smoking, but it is a stress reduction and pain reduction, definitely.
Probably block out some of your triggers. That was probably why the success was so well, why it worked. Probably because it helped one of his triggers. One of his triggers
Yes.
was probably stress.
Yes.
And it helped him relax.
That's true. Yes.
Rid of the need to have the cigarette.
It can help with that. What is going to make the most difference, though, is getting rid of the cravings for the nicotine. Yeah, that's really important. Do you work on cars?
How'd you know? Okay, does it just
Yeah.
yell at you?
Yeah, in your hands and yeah.
Yeah.
Do you like it?
That's fun. I work in auto collision, so I mean, I know a lot worse things than cigarettes, but I mean, that would be a start.
That would be great. So good luck with that. Call the 800 number that's in this brochure and talk to a counselor, or she can, and now we have 24 hours a day you can call.
That's convenient, because I work 54 hours a week.
That's a lot. So what you can do is go to the website. Do you have internet on your phone? So keep trying MA. Keep trying MA. Then you can do texting with the counselor, or you can do email on the
It's
computer.
like, it's not something I want to be on the phone with and have someone walk over and be like, yeah.
So you can enroll online to use the texting and the email.
Well, before I do that, I'm going to have to get some health insurance.
Well, the phone, you don't have to have health insurance.
Yeah.
That's free.
Oh, is it?
The phone counseling or the texting. The counseling is free.
That's neat. Okay.
You have to pay for the patches. Your insurance would pay for the patches. But again, if you have Mass Health, you should enroll. Talk to somebody here about enrolling on Mass Health. You should get Mass Health.
It's just time.
For you. You said
Like, I get out of work, like,
for smoking.
when this started.
Yeah.
And then I go into work at 7 a.m.
So there's a person here now that can help you with the Mass Health. If you talk to Jody,
I know, but I'm trying to eat here too.
Yeah.
So, like, trying to eat, you know.
yeah, just come and talk to her right away when you come in.
Yeah.
John had.
Because you're young. You're young at the beginning of your life.
I've been smoking since I was 13 or 12 years old.
Yeah.
I got ran over by a car, and I guess that was my first trigger. Yeah.
So as your brain's been growing,
I said, all right.
then it's been growing with nicotine, so that makes it harder to quit because your brain. So good luck.